When it's time for you to go home, we're going to give you written directions on what to do to care for your wound, what kind of activities that you should do and shouldn't do, and you'll have a list of all your follow-up appointments, whether they're with your surgeon or with a physical therapy office. We try to make it an easy transition to get you home, so we really overload you with information, saturate you with what you need to know. You'll also have nurse navigators that are calling and checking on you at specified intervals after you leave the hospital. Our discharges typically happen in the early afternoon, usually between 2 p.m. and 4 p.m. That gives enough time for physicians to round, prescriptions to be filled, therapy to see you after lunch for another round of therapy. You will need to arrange transportation to get home. Most of our patients are not going to be driving for about 4 weeks after surgery. We will go on and schedule your follow-up appointment with your surgeon. They will usually see you in their office somewhere between 10 and 14 days after your surgery date. Our case manager will arrange your outpatient physical therapy, so you'll have a date and time, you'll know where you're going. We try to make this an easy process, getting you home, so you're not having to go home, make phone calls, and make all those different arrangements. We take care of all that before you leave. Dressings we typically do not change. After surgery, if the dressing is still clean, looks good, it's intact, we just leave it in place. And those usually stay on for somewhere between 7 and 10 days after surgery. Dressing changes and care of that wound will be addressed on a patient-by-patient basis, as sometimes it will vary from one surgeon to another. Bathing instructions will vary per patient and per surgeon, so we'll cover that on an individual basis prior to your discharge.